recognized.
Thank you, Chairman Smith, and thank you, Secretary Becerra. You coming out, and you know how many hours you've been here for testifying, so I really appreciate that. You know, I am concerned about Center for Medicare and Medicaid Services oversight of new hospices and home health agencies. This is particularly an issue in California, which instituted a moratorium on state licensure January 1st, 2022. Despite this moratorium, hospices in California that previously received state licenses are still being certified by Medicare. In fact, 443 California-based hospices received Medicare certification in 2022. 375 out of 443 were issued in LA County only. Considering the moratorium in California and the state auditor's report highlighting these bad actors, why is Medicare still certifying hospices that are likely engaging in fraud?
Congressman, that's a great question. I'm not totally abreast of what the state of California, my state, is doing, but as you will recognize, the laws that guide us on Medicare and hospice care are different from what guides the state of California. What the state can do isn't necessarily what we can do, and vice versa. If someone applies to provide hospice care, we have to make sure that what they're doing is fulfilling the criteria that by federal law they must achieve. If they do, we don't have the luxury of saying, no, we won't, because your state is saying you may not be a good actor. We have to base it on the information they provide to us and if they meet the criteria to qualify for funding under Medicare.
So who does the audit?
Who does what audit?
These are hospice carers, especially hospice care takers.
If you're talking about the work that the state has done to suspend further licensing, then it's the state who would do some of those audits. If you're talking about the Medicare program, that's a federal program. The state does not operate Medicare.
So Medicare certifications, they were just still giving out to these fraud cases.
Medicare would not give out a
certificate
for operation of a hospice care program if it was doing it fraudulently. Those programs would have to be able to show that they meet the criteria. If they subsequently commit fraud.
So who finds out that they are fraudulent certificates or not? Who finds out? Because Medicare certificate that we are talking about here.
That's where you rely on the surveyors, the investigators who periodically go in to see how those programs are operating. The state might have some folks who are doing it. When I was Attorney General in California, we had the authority to go in and look at all of these different facilities for how they were caring for folks. That's why we expanded the program that actually looks into nursing homes. That's different from what the federal government does.
So, you know what, let me just change the issue. Okay. I'm going to go a little more deeply, and I'm going to work with you about this, fraudulent certificates. But like last week, constituents of mine from Fullerton and Placentia rallied on Capitol Hill about CMS decisions to deny senior access to vital Alzheimer's treatments. What do you expect me to tell my constituents about not having access to care because USC, Stanford, UCLA, UC Irvine, UC Berkeley, UC San Diego, these are just really good universities. They all say it's a breakthrough medication. So why not?
Congresswoman, I would tell you to tell them that you will advocate as hard as you can to make sure that where possible, we will make access to those medicines and services that help them with their particular condition or disease. And if they probe even further, you might want to make sure you can tell them the distinction, the difference between the work that the FDA does to make a drug available and the work that CMS does within the Medicare system to make those drugs available for reimbursement within the Medicare program.
So how are we going to do that, though? Because they're not reimbursing it. They've been denying those coverages.
That's where what I'm saying is people have to understand how CMS and Medicare operate so they can understand the decisions, the determinations that are made by CMS. CMS did provide some coverage for some of those Alzheimer's drugs, but under certain conditions.
This is a new one we're talking about. Yep. Yeah, you know what? My time is up. I'm going to do in writing, and I'll ask all these questions. Actually, I have more than 10 questions here that I want to ask you, but I just don't have time, so I yield back.
Thank you, Representative.